we have a question from Discord about DHT. If you have context on this, thoughts on DHT and 5-alpha reductase inhibitors in the case for Propecia finasteride. If you don't know too much, maybe comments on DHT specifically and if it's really important.
All right, so this person is asking about a hormone called DHT. So most people have heard of testosterone as kind of like the master sort of male hormone, but there are other androgens or male hormones that are very important, like DHT. So DHT is actually a derivative of testosterone, and it converts essentially naturally in your body from testosterone to DHT via an enzyme called 5-alpha reductase, or 5AR for short. DHT has a lot of different biological functions. I like to call it sort of like the aggression hormone. When your DHT is high, you feel a greater amount of confidence. You have a little bit more of that aggression, that edge, like a little bit more of that risk taking, if you will. It's kind of associated with those things. So I actually think it's useful and it's good. The downside of it is for people who are genetically predisposed to hair loss, or what's called androgenic alopecia. Androgenic meaning androgens like DHT contribute to it. So when DHT binds to the receptors, particularly in your scalp, it's associated with greater hair loss. So that's why one of the FDA-approved treatments for androgenic alopecia or hair loss is 5-alpha reductase inhibitors. It's basically drugs that inhibit the enzyme 5AR, as we talked about. So it basically blocks the conversion from testosterone to DHT. Of course, logically, as you do that, your testosterone is going to be slightly higher because less of it's converting to DHT, and your DHT levels will plummet to what are called sub-physiological levels, so even below the normal range. Finasteride does work to some degree in terms of reducing hair loss. Typically, at least in my clinical observation, it tends to slow down hair loss. I don't see a lot of people regrowing hair, although some people are able to regrow hair on it. There's two main downsides in my opinion. The first downside is in a small percentage of people, pretty rare, I would say it's single digits, 1 to 2% of people do experience sexual side effects from 5AR inhibitors like finasteride. This is called post-finasteride syndrome. The downside of it is in that very small percentage of people, it seems to persist even after they discontinue the medication. So even if after they stop taking Propecia, which is the brand name for finasteride, they're still having persistent sexual dysfunction in terms of low libido, inability to orgasm, and other sort of sexual problems. But it's been enough of a problem, and it's really debilitated that small percentage of people that they're very active, they're very vocal online. There's a lot of websites where you see people complaining about it, and there's been lawsuits, quite frankly, about it. So it's rare, but unfortunately, it is pretty drastic in terms of the side effects. So the majority of people, and this is why your doctor was like, at least in your doctor's opinion, it's fine, because it is fine for the majority of people. I do think there is a small but significant risk that if you take it, that you may develop sexual side effects, and they may not go away after you stop taking it. So it's up to you and your doctor in terms of weighing that risk and whether it's worth the trade-off, obviously keeping your hair. So that's one downside. Downside two, though, is, as I mentioned, DHT, like testosterone, is a key male hormone and androgen, and long-term suppressing it to levels that are sub-physiological, meaning like you're in the bottom 1th percentile of guys, means you're losing your masculine edge. The aggression, the competitiveness, the risk-taking is going to decrease because it's not just blocking it at the site of the scalp, it's blocking it systemically in your body. Propecia or finasteride is an oral medication or pill, so it's blocking it all over your body. Now, I do think there may be a future in which we have topical creams or foams that only inhibit DHT at the scalp site. But unfortunately, even topical finasteride, which I see companies out there promoting it, pretending like it doesn't absorb systemically, it totally does, unfortunately. In fact, I've looked at clinical data. 0.25% topical finasteride inhibits your serum DHT levels, meaning your DHT levels in your blood, as much as 1 milligram oral finasteride, the pill. So even if you take it in a pill form or you take it as a dropper or a foam, it still absorbs. And the reason is because the scalp is highly vascularized. There's a lot of blood vessels in your scalp, and it does absorb. You're dropping that on your head and it's trickling in. So the reality is, unless you're getting a blood test, you can't actually measure your DHT, by the way, in your blood. And that's why I've looked at this data. The topical version, unfortunately, is not any better. I actually think long-term DHT inhibition is not a great idea. There's an argument in addition that it's not just DHT contributes to hair loss, but it contributes to prostate growth, right? So guys get something called BPH, benign prostate hyperplasia, I think that's the term. The research on that is actually equivocal. There's in fact studies where they gave people synthetic DHT and it didn't necessarily enlarge their prostate. In fact, there's an alternative theory that some of the prostate growth that you see in guys is actually because of estrogen, not DHT. So I don't think we necessarily need to be afraid of DHT. It's there for a reason, and artificially suppressing it down to the 1th percentile, it may or may not save your hair, but it's gonna have systemic effects, which to me are just not worth it. I do think alternative FDA-approved medications such as minoxidil or Rogaine, it works through a different mechanism of action. It's not a 5-alpha reductase inhibitor. What that does is it induces vasodilation, and so increases blood flow to the scalp, which helps promote hair growth. Minoxidil is very mildly effective, I would say. It's over the counter, it's not prescription, you can go get it at any pharmacy. But at 5 to 8% dosages has been shown in studies to at least help a little bit. And I think for most guys, they're just trying to get all the help that they can get. I do think there are better stuff that is more effective for hair growth, hair and beard growth. And that's something we can talk about in a future episode at some time.